Okay, we'll study about the mechanisms of the innate immunity. So the first is let us talk about the on the epithelial surface. The first is the skin. The skin acts as a mechanical barrier as well as it has a bactericidal action by provide by the presence of the concentration of salts on the in the dry sweats as well as the sebaceous secretions as well as long chain fatty acids which are present on the skin can have a bactericidal effect on the bacteria. And there are two types of flora here. Transient flora means those which have got deposited and might be harmful, and the resident flora are the ones which are necessary for the body and they are present permanently on the skin. Whenever there is alteration, for example in the case of the clostridial enterocolitis, is caused due to the removal of this resident flora from the oral cavity by the use of the oral antibiotics. Transient flora should be removed, but resident flora should never be removed from the body. And if it is removed, it will cause some kind of diseases. Okay. Coming to the second one, that is the respiratory tract. In the respiratory tract, as you know, that is the nasal passages as well as the propulsion of the cilia and the cough reflexes play a very important role. And in the intestinal tract, the saliva has a inhibitory action on many of the bacteria, and if by some chance the bacteria enters inside, it will be killed by the gastric pH in the stomach. And there are some normal flora in the intestine, and there is a bactericidal action even in the intestine also. And coming to the fourth one, that is the conjunctiva. Here the tears that are secreted from the eyes are responsible for bactericidal action, and the lysozymes are mainly bactericidal in nature. Okay. And the urinary tract, the acidified urine is responsible for the elimination of bacteria from the urethra and the vaginal secretions. These vaginal secretions have an acidic pH due to the fermentation of glycogen by the lactobacillus bacteria that is present as a normal flora in the vagina, and they are responsible for the bactericidal action of the transient flora. And in males, the semen is believed to have some antibacterial action. Acquired immunity is the resistance developed during life. It can be divided into two types, active and passive. Active immunity is developed by an individual as a result of contact with antigen, and this contact with antigen might be either due to a clinical or subclinical infection, which is called as a natural type of immunity, and the or it can be due to the vaccination, which is called as the artificial type of immunity. So for this, what is the action produced by this active type of acquired immunity is that it stimulates both the CMI as well as the HMI or AMI. That is, it stimulates the production of the immunologically active cells, that is the T cells, and even it stimulates the B lymphocytes for the production of the plasma cells, which in turn will produce the antibodies. Okay. And this acquired immunity has two important aspects, that is, it is developing after a small latency period, but it will be very longly lasting. Coming to the mechanism of this active type of immunity, it is, as I have already told, that is, it stimulates both the humoral as well as the cell mediated immunity. Now let us start with the concept of passive immunity. The passive immunity is a type of immunity which is induced, or it is the immunity which is developed in some another organism, and it will be transferred to the primary host to whom the infection has been caused, and there is preformed antibodies will be given to that person. And remember that the anti-serum preparations will be given to the other host, which I have already told. And there is no latency, almost there is no latency in this passive immunity, and it is a short lasting one. And the advantages of this passive immunity is that the treatment of the serious infections can be taken place, and it also suppresses the active immunity, which are injurious in some cases. And it is short term, but it is fast acting. Since it is fast acting, for example, in case of a snake bite, we cannot wait for the active immunity to act, so we will be giving the passive immunity to the person to treat it very fastly. Then coming to the concept of the, let us talk a little bit more about the natural and the artificial immunity. Natural is particularly, it will be usually the transplacental IgG antibodies, which will be transferred from the mother to the fetus or infant. It will be transferred to the fetus through the placenta, that is transplacentally, and to the infant it will be transferred through the colostrum or the breast milk. Okay, and coming to the artificial type, it will be usually in the form of anti-seral injections, and it will be given through the parenteral route. And there are three types of sera, that is hyperimmune sera, convalescent sera, and pooled human gamma globulins will be given. Hyperimmune sera will be given in the case of tetanus. In order to treat tetanus, we will be giving in the earlier ages. Usually the horse anti-sera was used horse sera was used for preparation of the anti-tetanus serum. And the advantage was that it was effective, but what does the disadvantage mean? It was causing hypersensitivity reaction, and and some other problems, as like some other allergies, and were caused because the sera was not the that of the same species. But in the nowadays we are using the ATS of humans, which will be giving much better protection, longer protection, as well as it will cause elimination of the tetanus bacteria. And coming to the convalescent sera, what do you mean by convalescent sera? Convalescent sera is the sera which is recovered from the patients who have already been treated with the disease. For example, in measles and rubella, we will be using the convalescent sera, and pooled gamma globulins will be used in the case of hepatitis A. Coming to the miscellaneous type of immunity and immunizations, the first is about the combined immunization. As the name suggests, combined means both the active as well as the passive immunization is done. But the passive will take over first, because it is short acting, and it has almost no latency period. Until the active immunity takes over, it will be keeping on acting. Okay. And coming to the next one, that is adaptive immunization. Adaptive immunization means using the immunologically competent lymphocytes for the transfer into the host, and not all the lymphocytes, only the competent lymphocytes are used, and those competent lymphocytes are called as the transfer factors. And this has been used in the treatment of the lepromatous leprosy. And coming to the third one, that is the local immunity. This local immunity means the live viral vaccine or the natural infections which are introduced through the oral or through the nasal route can cause the development of local immunity at the oral and the nasal mucosa. For example, the IgA, in particularly the secretory IgA, are produced locally by the plasma cells, which are in turn produced by the B lymphocytes. Coming to the herd immunity, this is the immunity of the community. that is the overall resistance of the community, and if the herd immunity is less, then susceptibility to a pathogen in general will be more in that community.